Hello, this is Veronica Campbell from Integrated Manual Physical Therapy. This video is designed to help work with the neuroendocrine system, specifically the pituitary and hypothalamus. And so these structures are very deep inside the head and you can't physically touch them, but you can use pressure systems by placing pressure on your face and on your skull to affect them. And you can use eye tracking to help sort of decompress and detangle the pressure systems inside the head. So to understand that better a little bit before we start, please understand that sort of where your eyebrows are, right at this skull head eyebrows, at the eyebrow level and slightly below, right at midline, is the level of the pituitary. And just above the eyebrow level, right at midline, is the level of the hypothalamus. And so we're going to be checking on yourself the bone density there at just below the eyebrows for the pituitary and just above for the hypothalamus. So if we're looking inside of this, we understand that this is quite deep in. So we have what's called the falx and the tentorium. This is part of the cranial dura. This is venous drainage through here that helps regulate pressure systems in the brain. So this can affect pressure systems. This also is innervated by the trigeminal nerve. So tension and clenching and stress can create tension in here. This structure, if I take it out, has a little X right here. So where that X is where the optic nerves cross at the optic chiasm. Below it is the pituitary. Above it is the hypothalamus. So a lot of tension in the eyes or tension in this dural system can potentially affect tension in the pituitary and hypothalamus. And the pituitary sits deep inside the skull in the sphenoid in the sella turcica and through here. So again, pressure systems really affect this area. And if the pressure systems are affecting this area, it could potentially affect how your brain and neuroendocrine system regulate. And if your hormonal system isn't regulating well, especially if you're menopause or perimenopausal, you can start to get hormonal symptoms. So what I found is in all the women that I've treated with perimenopause and menopause, myself included, there tends to be tension in here. And if you self-treat, this can really help regulate tension and potentially help regulate some of the hormonal symptoms, especially hot flashes. So the way that I do this is I tend to like to have my hands and thumbs close together, and I'll bring them up and I'll first be talking through checking the pituitary level and then slightly above at the hypothalamus level. And so what you're doing is, I like this because then I can gently just lean my forehead on my thumbs. My thumbs are touching. And what I'm doing is first feeling the skin and then sinking a little deeper and feeling the muscle and then sinking a little deeper and feeling the bone. And as I go into the bone, I can kind of very gently compress and release a few times. So it's just this little nudge to wake up the mechanoreceptors in the pressure system to feel. And then I go in and I notice, does the bone feel very dense? Does the left side or the right side feel more dense? And just noticing what side might feel more density in it. For me, my right side feels more dense than the left at the pituitary level, but it's a minimal difference. And again, you're sinking in and feeling the give of the bone. So it's still very rigid, but do you notice a difference? Then you come up above that, sort of the eyebrow level and slightly up, and sinking in here again. Skin, muscle, bone in, and feeling the squishability or the density under your left thumb versus your right. And again, my right thumb is much more dense and rigid and sore feeling. So I have found a lot that it tends to be on the right side. It might be on the left for you, but either side, whatever side is the most dense and tender of those 4 points is where I'm going to have you focus your two thumbs. So for me, it was more the hypothalamus or the upper level on the right. So I'm going to focus my two thumbs there. And again, I go back in slow, skin, muscle, bone, and I sink in. And it's almost like I let my head kind of just sink onto my thumbs until it goes deeper and deeper and deeper. And once I feel like my thumbs can't sink anymore, I'm going to add eye movement. So I can play with looking to the right and notice how far can my eyes move? Does it feel tight? Come back to the middle, look to the left. Left is pretty easy for me. When I go to the right, my eyes feel like they can only go like halfway. Now I'm going to look down. That's pretty easy versus up. I feel like I can't look up at all. So I can play with those directions and simply look to the right and take a few breaths, and come back to the middle, and then look up and take a few breaths and come back to the middle. And I can do that a few times. Taking a breath, again, working with the pressure system. As we know, inhalation and exhalation affects the cranial pressure system. And then once I do that, and I feel like, okay, my eyes starting to move a little easier to the right, my eyes are starting to move a little easier up, then I can sweep my eyes around in a counterclockwise and clockwise circle to feel if there's any little snags or tight spots in that slide and glide of my optic chiasm and optic nerves that might still have a hitch. So I have one little spot. I can look at sort of up and to the right, and I can take a breath and release. And again, look up and right, take a breath and release. So spending some time playing with this and then coming out nice and slow. And you might have a few little like red marks on your forehead like I might. But you can go back and repeat and go back in and see, like, how's the squishability on my left versus my right at the pituitary level. There's still a little tension there. If I go back up where I was at the hypothalamus level, they feel more equal. So I might need to go back and do that right corner that's more related to the pituitary next. And so I typically was doing this about once a week and found that my hot flashes significantly reduced if I did that. So once or twice a week, this could be helpful. And hopefully it helps you feel better. Thanks so much. If you have any questions, feel free to reach out to your healthcare practitioners. And of course, I always recommend touching base with your healthcare practitioner starting something new. Thanks.